Hello, and welcome back to Life of Medical. Ever been at a doctor's appointment and they pick up this interesting little handheld device, dim the lights, and peer intently into your eyes? That instrument is called an ophthalmoscope, and today we're shining a light on exactly what it is, how it works, and the incredible things it can reveal about not just your eye health, but your overall well-being. It's often said the eyes are the windows to the soul, but in medicine, they're also a crucial window to your health. So let's take a closer look. What is an ophthalmoscope? Let's start with the basics. What exactly is an ophthalmoscope? An ophthalmoscope is a specialized, handheld instrument that healthcare professionals use to examine the interior of your eye, particularly the back part called the fundus. This examination is technically known as fundoscopy or ophthalmoscopy. The device is ingeniously designed to illuminate the inside of the eye and provide magnification, allowing the examiner to see important structures such as the retina, the light-sensitive tissue lining the back of the eye, the optic disc, where the optic nerve enters the eye, the macula, responsible for sharp central vision, and the network of tiny retinal blood vessels. It's a non-invasive way to directly view these delicate structures, providing invaluable information for diagnosing a wide array of eye conditions and even some systemic diseases. It's a fundamental tool in both general medical practice and specialized eye care. How does an ophthalmoscope work? The way this device allows us to see inside such a complex organ is quite clever. So, how does an ophthalmoscope work? At its core, an ophthalmoscope has a light source that projects a beam of light through your pupil, the black opening in the center of your iris. This light illuminates the structures at the back of your eye. The device also contains a series of lenses mounted on a rotating disc. The examiner looks through an aperture, a small hole, and can rotate this disc to select different lenses. These lenses have varying powers, measured in diopters, and are used to focus the view on the patient's fundus, effectively compensating for any refractive error the patient might have, like nearsightedness or farsightedness, as well as the examiner's own vision. The light reflects off the fundus, travels back out through the pupil and through the chosen lens in the ophthalmoscope, allowing the examiner to see a magnified image of your eye's interior. It's a brilliant application of optics to peer into a normally hidden world. Why is an ophthalmoscopic exam so important? This seemingly simple examination can reveal a wealth of information. Why is an ophthalmoscopic exam so important? Its importance is twofold. Firstly, it's crucial for detecting and monitoring a wide range of primary eye diseases and conditions, often before you even notice any symptoms. This includes conditions like glaucoma, by looking for changes in the optic disc, macular degeneration, changes in the macula, retinal detachments or tears, infections, or inflammation within the eye. Secondly, and this is fascinating, the ophthalmoscopic exam is unique because the eye is the only place in the body where blood vessels can be directly visualized non-invasively in their natural state. This means the exam can reveal early signs of systemic diseases that affect blood vessels throughout the body. For example, changes in retinal blood vessels can be an early indicator of diabetes, diabetic retinopathy, or high blood pressure, hypertensive retinopathy. It can also provide clues for neurological conditions like increased intracranial pressure, which can cause swelling of the optic disc, papilledema. It truly is a vital screening and diagnostic tool. Who uses an ophthalmoscope? This versatile tool is found in the hands of many healthcare professionals. Who uses an ophthalmoscope? While ophthalmologists, medical doctors specializing in eye and vision care, including surgery, and optometrists, healthcare professionals who provide comprehensive eye care, including vision testing and correction, are expert users and rely heavily on ophthalmoscopes for detailed eye examinations. They are not the only ones. General practitioners or family doctors often use direct ophthalmoscopes as part of routine physical examinations to screen for common eye problems or signs of systemic disease. Neurologists use them to assess the optic nerve, which is an extension of the brain. Emergency room physicians might use an ophthalmoscope to evaluate patients with acute vision changes, head trauma, or suspected neurological emergencies. Pediatricians also use them to check babies and children's eyes. Proper use and accurate interpretation of the findings require training and experience, as the views can be subtle and complex. Where is an ophthalmoscope used? Nareed. You'll encounter this device in many healthcare settings. Where is an ophthalmoscope used? Given its versatility and importance, ophthalmoscopes are used in a wide variety of medical environments. They are a standard piece of equipment in ophthalmology and optometry clinics where comprehensive eye examinations are performed. You'll also find them in general medical practices and outpatient clinics for routine checkups and screenings. In hospitals, ophthalmoscopes are used in emergency rooms, on inpatient wards, especially for patients with diabetes, hypertension, or neurological conditions, and in specialized clinics. Even in some community health screenings or mobile clinics, ophthalmoscopes play a role in assessing eye health. The portability of the direct ophthalmoscope, in particular, makes it easy to use in almost any clinical setting where an assessment of the eye's interior is needed. When is an ophthalmoscope used? This exam is a key part of many health assessments. When is an ophthalmoscope used? An ophthalmoscopic exam is performed in many situations. It's a fundamental component of routine comprehensive eye examinations, even if you have no vision complaints, as it helps in the early detection of silent diseases. It's also part of many general physical exams. If a patient reports symptoms like blurred vision, vision loss, floaters, flashes of light, eye pain, or persistent headaches, an ophthalmoscopy is crucial to investigate the cause. It's used to monitor patients with known eye conditions, such as glaucoma, macular degeneration, or diabetic retinopathy, to track disease progression and treatment effectiveness. Furthermore, it's used when a patient has a systemic disease known to affect the eyes, like diabetes or hypertension, to check for ocular complications. Any suspicion of neurological issues that might manifest in the eyes, like changes in the optic nerve, would also prompt an ophthalmoscopic evaluation. Peering into the window of health, what can doctors see? It's like looking at a landscape inside your eye. Peering into the window of health, what can doctors see with an ophthalmoscope? When a trained professional looks through an ophthalmoscope, they are assessing several key structures. They examine the optic disc, which is the head of the optic nerve. They look at its color. It should be a healthy pinkish yellow, the sharpness of its margins, and the size of the cup, a small depression in the center of the disc. An enlarged cup can be a sign of glaucoma. They meticulously inspect the retinal blood vessels, noting their caliber, looking for any narrowing, blockages, bleeding, hemorrhages, or abnormal new vessel growth, neovascularization, which can occur in diabetes. The macula, responsible for detailed central vision, is carefully checked for any pigmentary changes, drusen, yellow deposits seen in macular degeneration or swelling. The general retina is scanned for tears, detachments, lesions, exudates, fluid leakage, or signs of infection. Each finding contributes to a comprehensive picture of the eye's health. Different types of ophthalmoscopes, direct versus indirect, and modern tech. Not all ophthalmoscopes are created equal. Let's look at different types of ophthalmoscopes, direct versus indirect, and a nod to modern tech. The most common type seen in a general practice setting is the direct ophthalmoscope. This is a handheld device that provides a highly magnified view, about 15 times, of a relatively small area of the fundus at a time. It's excellent for examining the optic disc and central retina. Then there's the indirect ophthalmoscope, which is typically used by ophthalmologists and optometrists. This involves a headset worn by the examiner with a light source and a separate handheld condensing lens. It provides a wider field of view, a more stereoscopic, 3D image, and allows for better visualization through cloudy media like cataracts or vitreous opacities. It's also better for examining the peripheral retina. Beyond these, as of May 2025, we continue to see advancements like digital ophthalmoscopes and video ophthalmoscopes, which can capture images or videos of the fundus, excellent for patient education, documentation, and remote consultations, teledermatology. The patient experience. Is it uncomfortable? What about pupil dilation? Many people wonder about the exam itself. So, the patient experience. Is an ophthalmoscope exam uncomfortable? What about pupil dilation? Generally, an ophthalmoscopic exam is painless. The bright light from the ophthalmoscope might be a little dazzling or cause you to blink, especially when the doctor is focusing on sensitive areas like the macula, but it's not typically uncomfortable. Your doctor might ask you to look in different directions to get a better view of various parts of your retina. Sometimes, to get a clearer and wider view of the fundus, especially the peripheral retina, your doctor may need to dilate your pupils using special eye drops. These drops temporarily make your pupils larger. If your pupils are dilated, you'll experience light sensitivity. Sunglasses are helpful afterwards. And blurred near vision for a few hours, making activities like reading or driving difficult. Your doctor will always inform you if dilation is necessary and advise you accordingly. It's a small inconvenience for a much more thorough examination when needed. The ophthalmoscope, in its various forms, is a truly remarkable and indispensable diagnostic tool. It allows healthcare professionals to directly observe the intricate workings at the back of your eye, providing vital clues not only about your vision, but also about your systemic health. It's a testament to how interconnected our bodies are. I hope this has given you a clearer view of the ophthalmoscope and its importance. If you found this video insightful, please give it a thumbs up, subscribe to Life of Medical for more explorations into medical technology and health, and hit that notification bell. And, of course, don't forget the importance of regular eye examinations by a qualified professional. Your eyes deserve it. Any questions or perhaps an experience you'd like to share? Let us know in the comments below. Thanks for watching, stay curious, and take care of those precious eyes.